So moving into musculoskeletal disorders, Chapter 9, please make sure you do your readings and just read along and do your quizzes as you go. So we're looking here, this is just a normal synovial joint, which is a type of articulation between two bones. What you'll notice here is here's the bone, you see the synovial capsule or joint capsule. There is a synovial membrane that produces synovial fluid. You can see the articular cartilage that surrounds the bones, and it should provide, and the synovial fluid provides lubrication, and they shouldn't grind together. If the articular cartilage gets damaged, the muscles can grind, or if there's inflammation of these membranes, it can be very painful. So just going along with some diagnostic tests for bone disorders, we typically look at radiography, which is x-rays and bone scanning. For muscular disorders, we can do a biopsy or electromyography. And then for joint disorders, we can do like radiography, arthroscopy, where we go in and look inside the joints, and MRIs, which are magnetic resonance imaging. And we can examine the synovial fluid to see if there's bacteria or something in there. A fracture is one type of disorder. It's where there's a break in the integrity of the bone. These are typically caused by trauma, but it can also be related to neoplasms, which are tumors, and increased stress on the bones. Fractures are charted using the pound sign. I was about to say hashtag, but the pound sign is the same thing. Fractures initiate what's called an inflammatory response in homeostasis. You can go back towards your inflammatory chapter to learn a little bit more about that. The first step is usually there's going to be broken blood vessels, so there's going to be bleeding. Swelling is going to occur, and it can stretch the periosteum if it's still intact and it's not, if the bone's not poking through. And it's going to also lead to swelling of the soft tissues and severe pain. Remember the chemical mediator bradykinin and other, what was the other one? Histamine, I think, contribute to pain. Also, the clot ends up forming at the site and kind of temporarily holds the two bones together. If, depending on the degree of the fracture, you can sometimes see systemic signs of inflammation throughout the whole body because the release of the chemical mediators. During the hematoma, the fibrin network is formed. You remember, fibrinogen turns into fibrin, and that is catalyzed by many factors, and that's what's going to happen first. Phagocytic cells to remove the debris, fibroblasts to lay down new collagen fibers, and we're going to form like a new fibrous collar or callus formation around the bone. Then eventually osteoblasts will, the cartilage dies and the osteoblasts generate new bone. And so the procallus is replaced by a bony callus, and then we can finally reshape the bone and remodel it by using the osteoclast afterwards until it goes back to its normal shape and size. So we can see here blood clot here, the chondroblast and osteoblasts are in there, and it's going to form this callus. The callus forms and it kind of holds everything together, and then it's replaced with bone. And then we will remodel that bone until it looks back into the healed state. There are a few factors that, there's quite a few factors that affect bone healing. One of them is exactly how much damage is actually done, how close the bone ends are. So you may have to do a reduction, which actually closes the gap in between the bones by physical manipulation. If there's presence of foreign material or bacteria, it can cause infection and additional inflammation. If the blood supply is damaged, it can also lead to a slower healing. Systemic factors also include age, which we know it takes longer for the elderly to heal from broken bones, and it's even shorter for children. Nutritional levels. Did you get enough calcium, vitamin D, and even anemia for various reasons? Okay. Some complications of fractures include muscle spasms, infections, ischemia, fat emboli, and remember, because we have yellow bone marrow, and that can be released into the blood. Nerve damage, failure to heal or deformity during healing, where you don't get the full use of the limb or the broken bone, and residual effects such as osteoarthritis. Types of treatments: close reduction, pressure to restore the bone to its original position, where it's just on the outside of the body, there's no punctures or anything. Open reduction is where you have to do surgery to go in there and insert pins and rods and align the bone into place. So it's through surgery, so opening up that wound. A risk of that is associated with bone fractures is Compartment Syndrome. This is where there's severe edema that can localize in a compartment between the layers of dense connective tissue. And since it's a lot of edema, that area doesn't have very good blood flow and doesn't have good flow of nutrients and waste, and it can lead to ischemia and infarction of that tissue, and because of the compression of the arterial blood supply. So it doesn't allow the blood flow, and it can end up actually getting infected and bone become gangrenous and actually require amputation. Sometimes one of the best things to do, what your doctor's going to do, they're not going to put a cast on immediately after the injury. They're going to put probably some kind of temporary cast or a sling, and then that's going to allow some of that edema to go down before they actually put the permanent cast on, because they don't want that cast to trap the fluid and swelling in that area. The next disorder is a dislocation. This is a separation of two bones at the joint, and with a loss of contact between the articulated surfaces. So the bone normally functions together and it moves in conjunction. It's where there's a dislocation, it's popped out of place. It's usually accompanied by some soft tissue damage, along with damage to the ligaments and tendons. The distortion of the joint you can usually physically see. If it reoccurs repeatedly, then it may require some kind of surgery to stabilize the joint. So here's an image of joint displacement, and you can see the dislocation where it's actually out of place. It should be right there inside of that, near that glenoid cavity, but instead the head of the humerus is dislocated, out of place. Sprains and strains. A sprain is a tear in a ligament. Ligaments are between bone and bone. And a strain is a tear in a tendon, which is between muscle and bone. Avulsion is where they are completely separated from their bony attachments. And for treatment, immobilization is used, and this allows the bones, the tendons and ligaments to naturally heal and promote healing. Other joint injuries include overuse injuries, where it can lead to muscle tears. Also, repetitive strain injuries, which develop over a period of time where the same movement is repeated over and over. Some things that can cause these repetitive strain injuries include scaling, massage, keyboard use and mouse use, and running and jogging. So you need to know the correct occupational, what are they called? Occupational tips to minimize repetitive strain injuries in a lot of cases. Muscle tears can occur through overstressing the muscle or trauma or overextension. When there's repeated injuries, fibrous scar tissue can form. And remember that scar tissue is not going to allow as much movement because it actually constricts. There are a few different degrees of muscle tears. There's first degree, second degree, third degree. First degree involves only a small percentage of the muscle fibers. Second is most of the muscle, but it's not completely tore through much of the muscle. And third is it's completely torn all the way across through the whole entire muscle. To diagnosis of joint injuries include you need to know the history of the joint use and any previous trauma. Physical examination of the joint, including range of motion, so you need to establish the baseline. X-rays or MRIs, arthroscopy may be done along with the treatment at the same time, like if you're removing bone spurs or different things like that, or cleaning out that joint cavity. A good mnemonic for treatment of joint injuries is RICE, rest, immobilization, compression, and elevation. The rest is going to allow time for the inflammation and swelling to go down. We immobilize it and compress it, hold some pressure on it, and keep, like I said, remove some of that edema from that area by elevating. NSAIDs can reduce inflammation. Physiotherapy and massage around the adjoining tissues is a big one there, because we want to keep that range of motion and the tissues and increase blood flow. And most of y'all probably know more about that than me. Bone disorders include osteoporosis, where there is actual decrease in bone density and mass. This is where we have less bone as typically as we age. There's two forms. There's the primary form, which is idiopathic, which again we know means that we don't know what causes it, but as we get older, 50 plus, our hormonal levels decrease, and sometimes our calcium level decrease, and this can lead to osteoporosis, the weakening of the bones, and our bone mass and density, and that's primary. And then secondary is where another disorder comes in and causes osteoporosis. The pathophysiology is the bone reabsorption. So the breaking down exceeds formation. So breaking down is more than the building up. It results in the loss of compact bone in particularly, and it can be diagnosed through bone scans, bone density scans. It also leads to a lot of compression factors, such as in the vertebrae, wrist, and hips. And this is, you always hear about, if somebody falling and breaking their hip, this is one of the major reasons why it's weak, low-density bones through osteoporosis. It also can lead to kyphosis and scoliosis, which are vertebrae alignment disorders, which is humpback and then an S-shaped. Kyphosis, the humpback, and scoliosis is the S-shaped spine. Predisposing factors include age 50 plus, decreased mobility and sedentary lifestyle, exercise, and weightlifting in particular can slow down the rate of osteoporosis. Hormonal factors including increased steroids, corticosteroids, and parathyroid hormone can lead to the breaking down of the bone. Also, low levels of estrogen and testosterone can do it, especially like after menopause with low estrogen levels. Deficiencies of calcium, vitamin D, protein. Cigarette smoking decreases bone density. Extremely low BMI, which is where you don't have much weight on you, so that you're not stressing your bones enough to keep maintaining their bones. Those of Asian and European ancestry seem to have higher rates of osteoporosis, and also excessive caffeine intake. Treatment is dietary supplements, weight-bearing exercise, physiotherapy to reduce pain and maintain function, bisphosphonates, calcitonin, which is going to cause bone to develop, human parathyroid hormone. Okay. For the breaking down and building up the bone. Next up, we have Rickets and Osteomalacia. Result from the deficit of vitamin D and phosphates. The causes are usually can be dietary deficiencies, malabsorption, intake of phenobarbital, and lack of sun exposure, because our sunlight helps us with vitamin D, production of vitamin D. We all need a few minutes The darker skin we are, the more minutes we need out in the sun. In children, it can lead to weak bones and other skeletal deformities in adults, like the bulge-shaped legs in children. In adults, it can lead to soft bones, which have a higher likelihood of compression fractures. Paget's disease. This is another disorder. It is found in adults older than 40. The cause is not known. And it's where the bony tissue is replaced by scar tissue, fibrous tissue, and it leads to a lot of fractures. The fractures are caused by the Paget's disease. That's why they're called pathologic fractures. And the vertebrae, they can cause compressions and kyphosis. And in the skull, we can end up having increased intracranial pressure and headaches and compression of the cranial nerves and lead to severe pain. Osteomyelitis is infection of the bones. Myelitis is the infection by bacteria or fungi. The symptoms can include local inflammation and bone pain, and because you can't see the bones, you can't really see it's infected. So you're going off for more of inflammation and bone pain, fever, and excessive sweating, chills, general malaise, just being sick. The treatment includes antibiotics and, if necessary, surgery. Abnormal curvatures of the spine are lordosis, which is sway back, which is where the lower back sway curves inwards, and it can be caused by obesity and some other genetic factors. Kyphosis, which is humpback or hunchback, where it's abnormally rounded upper back, and this can come from posture or, like I said, some other disorders. And then scoliosis, which is where the spine is S-shaped or C-shaped, and causes abnormal alignment. Then we have muscular dystrophy, which is a group of, so we're moving on to muscles, is a group of autosomal recessive disorders. So this is autosomal, means it's on the chromosomes that aren't sex chromosomes. So it's the 22 chromosomes that aren't sex chromosomes, and it is muscular dystrophy, and it's the degeneration of the skeletal muscle over time. One of the biggest reasons why this keeps popping up in muscular dystrophy is the protein that is really big, and so there's a lot of DNA in that gene. So the more DNA we have in that gene, the more likely there's going to be mutations, and new mutations will occur inside of that gene. And so that's why a lot of them are new mutations that the parents didn't have, but they end up in the child. The most common type can be passed down as Duchenne's muscular dystrophy or pseudo-hypertrophic muscular dystrophy. It affects young boys. With muscular dystrophy, you really want to think about skeletal muscle. So all the muscles we can voluntarily control, including the diaphragm. And the diaphragm we can breathe in and out. And so it is a skeletal muscle, so it degenerates also. So signs and symptoms for Duchenne's includes early motor weakness, difficulty getting up, weakness in the pelvic girdle, the gait, can't pick up the legs, so waddling, difficulty climbing stairs. The Gowers maneuver is where you walk your hands up. When you're getting off the floor, you walk your hands up to your knees and then your thighs and push yourself up. Tendon reflexes are reduced, and deformities develop, such as kyphoscoliosis. Kyphoscoliosis, because of the posture and the weak muscles. Respiratory infections are common because of the difficulty, expelling that expectorant. And then cardiac myopathies can occur. Diagnostic tests mean identifying the genetic abnormalities, looking at the creatine kinase levels, because we know creatine kinase is what helps make creatine give us extra energy in our cells.
Creatine phosphate can be used to make ATP. So if we're having muscular degeneration, as those are getting damaged and dying, it's going to release that creatine kinase. So that it's going to indicate damage. Electromyography is going to shot the cells and look at them. Biopsy, and then also abnormal dystrophin levels. Okay. Treatment, so far as no current treatment available. Try to exercise, moderate exercise to maintain motor function. Supportive appliances, physiotherapy, occupational therapy to maximize function. Massage to reduce pain and stiffness. A ventilator can be necessary if respiratory failure plays. Research is currently being done on genetic therapies. Like I said, there's a few different types. There's X-linked, which is on the sex chromosome. There's some autosomal on the non-sex chromosomes. But just because the size of this protein and the length of DNA that it has, it's going to be more likely to get mutations. Let's stop right here and split our video.